So ThedaCare got started in the lean journey around 2004. And we hired a consulting group with a business model. We started about the same time as Virginia Mason. And we went about this in 2 different ways. Virginia Mason did it a little differently than we did. Our business model was we're going to do value streams. They're going to spin off Kaizens or rapid improvement events, and we're going to implement action plans. And so John, being the big thinker and visionary that he is, had George Constacker as his mentor. We had our consulting group join us, and we identified 16 value streams to kick it off with. 16 enterprise-wide value streams. It was incredible. It was incredibly exciting, and it was incredibly painful, because the amount of change coming at an organization from that many value streams from the get-go was huge. But we were seeing breakthrough results. So I'm going to talk from my OB experience and from my cancer experience, because they were 2 of the first value streams. So our radiation oncology department saw 30% improvement in access 3 years in a row. We saw 28% improvement in productivity 3 years in a row. How do you sustain that? And so I had managers and staff coming to me saying, we don't know how to lead in this, we don't know how to manage this, we don't know how we're going to handle this level of change coming at the organization. That created the platform for a management system. And that wasn't something our consultant was doing. So what was important to me in understanding this is we had a really good understanding of the tools because of the values. We were doing 6 to 8 rapid improvement events a week in the organization. And we're celebrating them with 200 to 300 people every Friday at what we call Report Out, what Jim O'Met calls the Revival Tent. We celebrated that change, we celebrated this improvement. So I'm not going to go through this slide, but this is fundamentally, we had to have these fundamentals in place before we thought about a management system, because in the management system, you have to become capable of using these. So at ThedaCare, we had these value streams and rapid improvement events. We also had a 1-day training for all of our staff. We didn't do belts. We just called it our orientation to lean. So everybody had 1-day training. Then we recognized that as they went through events, after they went through 2 to 3 events, they became engaged in the organization. So some of our original metrics were process metrics. How many people are we getting through? What are they learning? How many changes are we making? But these tools, all of the lean tools, became critical to that. So I'm going to tell you that's a given. I'm not going to talk about tools anymore. I'm going to be talking about the cultural and leadership transformation that happens with the management system. The third piece of this, and we got this in a little out of order. We had True North, but we didn't do Ocean very well. And so we had these 3 or 4 or 5 strategies that we had what we called A3s. They weren't really very robust A3s at that point that were deployed to the organization, but no one knew what to do with them when they got to them. So the management system also became that opportunity not only to look at daily continuous improvement and measure and improve work every day. It took those potions, it took the strategy deployment that was deployed from the top and took it with the improvement from the bottom, and it locked them together so that people could see how their work every day improved the operational aspects of the business, but also the strategic aspects of the business. So it's important to recognize that all of these components come together. So the next step in our journey was developing the lean management system. I wanted to call it a lean management system, but our CEO Dean didn't like the word management, so we called it a business performance system. I don't care. I wish we didn't call it anything. I wish it was just, this is how we do our work at ThedaCare. So yeah, I think when you work something up, you got to call it something, but the sooner you can get rid of that name, the better. So today's discussion, I'd like to talk about how we created our system. I want you to think about models of cascading information effectively across organizations. How do we implement systems where employee coaching and mentoring occur daily? Because that's the underpinning of everything we do. And explore the concept of building standard work for all leaders in Theda to support daily continuous improvement. Here's my disclaimer. I'm going to talk to you about what we did at ThedaCare. I left ThedaCare, the delivery model last April, and I visited about 30 hospitals across the country this year. And people are doing it differently. The elements I talk about all seem to be present, but it is not the management system. It is just a way of exposing you to what ThedaCare ThedaCare does so that you can steal whatever works for you, but you have to develop your own system in your own organization because your cultures are different. So a lot of people say, why don't you just give us our standard work? And I'm like, that would be total waste. It would never work. It's about that journey of thinking about what we need here to understand our business differently. When I started this journey, I had some pushback. And I had a sensei, Jose, who was talking to me a lot about model cells, but he didn't call them model cells. He drew me pictures on napkins of little squares, saying, Kim, this is a cell, and when it works in one cell, you spread it to two. You spread it to two, and then it works in four, and then you can spread it everywhere. And he said that to me for like a year at dinner every time I went out, and I'd say, that is such a great idea. Jose, thank you. I had no clue what he meant to be telling me. So he kept, when we saw this gap, he and I started working on an A3 together. And I started shopping that A3 around, and I panicked. The HR team and the lean team, what are you doing? And so I was fortunate enough to have a CEO that said, we're going to run this, we're going to take Kim and let her be rolled over here and experiment with this. And we're going to let this develop and see what it becomes. So what I wanted to do to make sure that it was respectful of everybody was to take the work of our human development value stream, which had been in place since the very beginning of one of our 16 value streams, and they were working on how do we move people through our organization, how do we develop leaders, what are our core competencies of leaders, how do we promote people, and we took all of that information and every piece of standard work we developed. We thought about how does this impact our leaders, how do we develop skills, how do we hire differently for behaviors. So we stole everything they had and encouraged it there. We also took all of the tools from our lean office, which we call our ThedaCare Improvement System, and we pulled that together as the two whats we were doing, and we developed the how. The business management system is about leader standard work and developing the discipline to do that work every day as a way to deliver improvement. Okay? This slide saved my butt, so I'm going to keep it forever because no one understood what I was trying to do. When we moved into doing this work, of course, Jose and I had an A3, and then we used the lean tools to develop the management system. So the first piece of work was I pulled our two senseis together and said, you're no longer senseis, you're subject matter experts, because they had been in business where there had been management systems, from Toyota to Lear to the pharmaceutical industry. And so I pulled them together for a week in a room, and we used the tools, and we identified 57 pieces of standard work to begin developing the management system. That was in May. In August, we pulled 30 people together for the largest, longest rapid improvement event on record at ThedaCare. It was a 2-week event with 30 people, and we went through the A3 and we started to flesh out what the management system looked like and what that standard work would look like. This is the reason for action in 2008 when we had that event. And it was that we're on this cultural transformation, and our current system for managing the business isn't in alignment with our new expectations. We had wonderful managers, they were heroes. They all had their data, they were doing great work, but we couldn't measure them across the system because they all did it differently. We didn't know how to measure performance. Everybody had their goals, they measured it differently. And we didn't have one consistent way to problem solve, and our system made a determination that we were going to use lean, we were going to use root cause analysis, we were going to use A3s, and so we had to teach people how to do that beyond filling out a form. We had to teach A3 thinking. We had to teach problem solving. So our goal became to develop our people to solve problems, and we recognized if we were doing that every day, we would improve performance. So as I talk about the system later, I'm going to reinforce to you that it's first developing your people, teaching them to be problem solvers, and then measuring and improving performance in a consistent